My name's Asif Qasim. I'm the founder and CEO of MedShr, and I'm really pleased to be giving this update to the Innovation Showcase about MedShr's Insights and Early Warning System, which has been supported by the Trinity Challenge. We launched MedShr in 2015 with a really specific mission to empower doctors and healthcare professionals to use their own smartphone to capture, share, and discuss clinical cases. MedShr has grown rapidly since then and now has over 2.5 million members in 195 countries, using the platform primarily for clinical case discussion and peer-to-peer learning. And those case discussions reflect their real-world medical practice and the clinical cases that they see every day in the hospitals, clinics, and other places that they work. We're unique in that we've got a global reach, particularly into low and middle income countries, and MedShr has been described by Sir Tim Berners-Lee as a unique repository of medical knowledge. When clinicians come to the platform, they see something that's familiar because we've used the best of social network technology to connect clinicians with one another and empower them to use this global network to learn from one another. What that means is that we've got this universe of real-world medical information about the conversations that doctors are having. So from the cases, the comments, the polls, and the discussions and the votes, we've got a huge amount of MedShr data, and it's a unique data set. What we've done with MedShr Insights is develop medical natural language processing and AI algorithms to extract clinical insights from those data. So we know exactly where any healthcare term on the platform has been used, its context, and what that applies to across different trends and times. Developing the early warning system is an extension of the MedShr Insights platform to see if we can identify infectious disease outbreaks and detect new clinical insights around infectious diseases. So from a technical point of view, we used a version of the MedCat trainer to develop our medical natural language processing that allowed us to train and learn from existing clinical cases to annotate and recognize terms in this informal medical text and conversations that we had, referenced against the SNOMED CT taxonomy and RX norm drug name database. Developing from that initially therapy areas and disease-based insights, going on then further to look at further trends. In terms of that medical natural language processing, it's a named entity recognition model that starts with a creation of these concept databases that are then turned into supervised and unsupervised training to develop deeper insights from the platform. In terms of how we then reference that, we use, as I said, the SNOMED CT taxonomy and RX norm branded drug names so that we can see what's being used on the platform and cluster related concepts together so that, for example, we capture all the references to a specific term, such as COVID-19, from the variety of different clinical SNOMED CT taxonomy terms that may be used. We've turned these into engaging data visualizations that can be explored by clinicians and clients. And to start with, what they see is a bubble map that shows the terms used around a specific therapy area with the size of the bubble reflecting the frequency of use. They can explore this and they can look at the intersections between terms and they look at how they range over time and in different geographies. So, for example, you could look at COVID-19 specifically around the symptoms or the treatments, or at how it intersects between different parameters across that whole data set that we have. Moving on from that, what we're able to do is to look at the emerging terms around a specific disease area. So these are terms that are increasing in frequency over a specific period. And likewise, the trending terms that have looked like they're increasing in frequency and already being mentioned within the context of that therapy area. We're just starting this journey. We've made great progress so far in developing MedShr Insights. In terms of the next steps, we're looking, of course, to always increase our membership and case discussion because this increases our depth of data. We're keen to work with partners in global health education to extend that reach further. We're seeking additional funding so that we can continue the work on the early warning system and develop those insights further. And as well as that, we're also looking for partners with additional data sources so that we can develop infectious disease insights and mapping models so that we can build out the early warning system to give real value to clients and partners. Thank you for your attention, and thanks again to the Trinity Challenge for their support.